Today topic of discussion glucose-6-phosphate dehydrogenase deficiency. What is glucose-6-phosphate dehydrogenase deficiency? This one is the most common enzymatic deficiency of RBC. Most common enzymatic deficiency of red blood cells, about 7.5% of world population. 7.5% of world population is deficient in this enzyme, but it varies from different group of individual. For example, 60 to 70% Grudish Jev are deficient in glucose-6-phosphate dehydrogenase. And some part of Africa, the prevalence is up to 35%, and it is believed that efficiency in this enzyme may be productive against the malaria, and this condition is inherited in an X-linked recessive inheritance. Now, efficiency in this enzyme may be productive against malaria, and this condition is inherited in an X-linked recessive inheritance. Now, individual with that deficiency in glucose-6-phosphate dehydrogenase may experience hemolytic anemia, and babies that have a deficiency in this enzyme may experience neonatal hyperbilirubinemia or neonatal jaundice. So it causes hemolytic anemia in the case of adult. In the case of babies, it will causes hyperbilirubinemia or neonatal jaundice. Now, what is pathophysiology of glucose-6-phosphate dehydrogenase deficiency? Because the glucose-6-phosphate dehydrogenase enzyme is very important or crucial in that pentose phosphate pathway. The pentose phosphate pathway is negatively affected when this enzyme is deficient. In fact, we look this schematic of that pentose phosphate pathway. We can see the reason why the glucose-6-phosphate dehydrogenase enzyme is so important. It is first step in that pentose pathway, and it generate NADPH. So NADPH is generated from that dehydrogenase reaction of glucose-6-phosphate by that enzyme glucose-6-phosphate dehydrogenase. NADPH is generated from the DH reaction, dehydrogenase of glucose-6-phosphate by that enzyme glucose-6-phosphate dehydrogenase. That NADPH that is generated can be utilized by glutathione reductase. This NADPH is utilized by glutathione reductase to reduce that amount of reactive oxygen species. So to reduce the amount of reactive oxygen species, so when this enzyme is deficient or absent, what happen is NADPH here NADPH decreases, and this reduced glutathione reductase enzyme activity, which then would reduce its ability to clear reactive oxygen species or ROS, which would increase reactive oxygen species, which would increase reactive oxygen species. So increased reactive oxygen species will then actually damage that RBC. That one will damage RBC. Here what is the problem? Because of the deficiency of enzyme, this NADPH level decrease. Because of this one, reactive oxygen species level increases, so it will causes damage that RBC. So depending on that extent of which the glucose-6-phosphate dehydrogenase enzyme is affected, you can get even more reactive oxygen species, more damage to RBC cell, but it depends on how much of that enzyme glucose-6-phosphate dehydrogenase is affected or what its activity is, and it leads to the classification of glucose-6-phosphate dehydrogenase deficiency condition. So, this condition is classified depending on that severity by which the glucose-6-phosphate dehydrogenase enzyme is affected. So, some individual are affected less, some individual are affected more, and it depends on the activity of that enzyme or the amount of enzyme that is functional. So class 1 glucose-6-phosphate dehydrogenase deficiency is most severe, and this is when individual have less than 10 percentage of normal amount of glucose dehydrogenase enzyme and less than 10 percentage of normal activity, and this individual experience chronic hemolysis. So first one is classification 1, glucose 6-phosphate dehydrogenase deficiency, when individual have less than 10 percentage of normal amount of glucose 6-phosphate dehydrogenase enzyme or less than 10 percentage of the normal activity, this individual experience chronic hemolysis. Class 2, these individual also have less than 10 percentage of normal, but they only undergo intermittent assist to opposite to chronic hemolysis. In class 1 and this individual are typically have a ALICE. The Mediterranean ALICE, Mediterranean allele of glucose-6-phosphate. Class 3, this one they have Mediterranean allele. Then class 3 have 10 to 60 percentage of normal activity, 10 to 60 percentage of normal activity, and again this individual also have intermittent hemolysis and they have glucose-6-phosphate dehydrogenase A alleles. Glucose-6-phosphate dehydrogenase alleles. Then class 4 is considered wild type. These are normal individual. So normal individual have the wild type of allele glucose-6-phosphate dehydrogenase B. Here A, here B. And these are considered normal. So class 4 glucose-6-phosphate dehydrogenase are normal individuals, and there is also class 5. Class 5 is interesting in that they actually have more or increased activity of glucose-6-phosphate dehydrogenase. They have about 2 times the normal activity, and there does not seem to any clinical issue with this individual at all. So what are some of that blood finding of glucose-6-phosphate dehydrogenase deficiency. So class 1 less than 10 percentage normal, but this one is the chronic. Less than 10 percentage of normal, intermittent. Class 3 10 to 60 percentage normal. Class 4 normal type. Class 5 this one is 2 times of that normal activity, does not seem any clinical issue with this individual at all. So now that glucose-6 phosphate dehydrogenase deficiency, here blood finding. One of that most common we look at blood smear is anemia, but the anemia is normochromic and normocystic. So there is no change in or no excessive power and the cell are typically normal. Now there are issues where there maximum normochromic, normocystic, normal color and normal cell size, but some issues, it will shows anisocytosis. There is deficiency in safe, okay, safe of cell, and increase red cell distribution with some cells are smaller and some cells are bigger. So there is an increased range of cell size. First one is anisocytosis. In this one, increased red cell distribution with then phagocytes, that means different shape. Then we can find out pite cell, that means abnormal cell look like biton. Then we can find out hens. So three different type of anisocytosis: phagocytes, bite cell and horns bodies. Then coming to clinical presentation, maximum of that individual, majority asymptomatic only. Individual some okay, sometimes majority of the time asymptomatic, but they have some individual they will fail neonatal hyperbilirubinemia. Then chronic hemolytic anemia, then acute hemolytic anemia. So this one, majority of the cases asymptomatic, that means no hemolysis, no anemia. Some individual they may feel this one, neonatal hyperbilirubinemia. Then chronic hemolytic anemia, this condition is the very rare condition. Then acute hemolytic anemia. So here what are the factors triggering that acute hemolytic anemia? Triggers factors include some medication, tabzone and nitrofurantoin and primacune, methylene blue and dimercaferol. These are the factors trigger and causes acute hemolytic anemia. Chronic condition rare only, acute condition because of some medication, tabzone, nitrofurantoin, then primacune, methylene blue, then dimercaferol. Other chemicals, food also triggers acute hemolysis in patient. What are the things? Naphthalene, then henna dyes, then fava beans, then legumes and red wine. These are the food and chemicals also causes triggering acute hemolysis. Then diagnosis and treatment of glucose-6-phosphate dehydrogenase deficiency. Screening test, that fluorescent spot test, most reliable and sensitive. By using this one we can detect NADPH fluorescence. Then globin reduction test also. So fluorescent spot test, this one, then we can deduct NADPH fluorescence, then methamoglobin reduction test, then confirmatory test we are using. If positive, screening test, um, glucose-6-phosphate activity and NADPH generate. By using these two things we can confirm by using this confirmatory test. Then treatment, management, avoid unsafe medication and dietary restrictions. Then folic acid supplement, for chronic hemolysis, how much? 1 mg per day. Then if necessary will do that blood transfusion. Management, avoid unsafe medication under dietary restriction. Folic acid supplement, if need, blood transfusion is necessary. So this video discussed glucose-6-phosphate dehydrogenase. This one is the most enzymatic deficiency. It is causes hemolytic and neonatal hyperbilirubinemia. This one, NADPH generate is necessary to prevent red cell damage from the reactive oxygen species. So because of this enzyme defect, here what this reduction of NADPH, it will causes that increasing amount of reactive oxygen species, that one will affect RBC. So NADPH level decreasing, increasing level of reactive oxygen species. 5 different type of classification. Then blood finding, clinical presentation, medication, then screening test, treatment. Thanks for watching.